They offer comprehensive eye care to all of their patients across Central Illinois. Sponsoring our segment this afternoon is Chittick Eye Care, and with me is Dr. David Sola. Welcome back, Dr. Sola.
Thank you so much, Ryan.
You are the resident glaucoma and cataract expert here in Central Illinois, doing wonderful work at Chittick Eye Care. How are things going?
They're going great. We've been incredibly busy the last 3.5 months, seeing a lot of patients. I feel that I was needed here. There hasn't been a glaucoma specialist here in Central Illinois in about 7 years, and I can see that in all the patients that are coming to see me.
You're fitting a real need.
Yes, definitely, and it feels good. It feels good that I'm helping the community and working with the patients. And again, this model we're creating at Chittick Eye Care, where we're collaborating with 11 incredibly talented optometrists and myself and the surgeon, I think is going to benefit a lot of patients in Central Illinois.
And when we say comprehensive care, I mean, we're talking about optometry, just your normal, like, get your eyes checked, get your glasses, all the way to some of the more significant things like glaucoma or cataracts. And, you know, how does that work, like you guys working together as a team, optometrists and ophthalmologists?
Well, I think it's incredibly important. There's going to be a shortage of eye surgeons in the next 10 years, and I think collaborating with optometrists is really the way of the future. There's not going to be enough people to do surgery. And what we're trying to create at Chittick Eye Care that very few places in the country are actually doing is educating the optometrists and all the nitty-gritty of cataracts and glaucoma so that we work, you know, perfectly together. We're seamlessly together. We have the same medical record system. They have my number. We really are a great team to take care of the patients from A to Z, you know, from having the surgery all the way to getting glasses if they need them. We can do it all at Chittick Eye Care.
That's incredible. Now let's talk about glaucoma today. There's a lot of new technology available, a lot of cool things going on, and you've been at the front end with some of these research studies at Harvard and other places. But I am curious, what is minimally invasive glaucoma surgery? Or I think you guys call it MIGS.
MIGS, that's correct. Yeah, no, it's very exciting. MIGS is fantastic. It really has changed the way I treat my patients. It used to be many years ago that you could only do very invasive glaucoma surgery, or otherwise patients would have to use drops the rest of their lives. And nowadays we have so many different options that are minimally invasive, which basically means you're not really doing a big surgery. It takes like 5 minutes at the same time as cataract surgery many times, or 5 minutes by itself if you want to do minimally invasive glaucoma surgery or MIGS. And the great thing about MIGS is that the recovery process is a lot faster than the more invasive cataract surgery, and it can still be very effective for some patients.
And I'm seeing some of these procedures it's iStent Infinite, is it goniotomy?
Goniotomy, yeah.
I know, it's tough. Streamline. How do you determine which procedure is best for a patient?
No, that's a great question, and it really depends on the patient. I tell patients we individualize care. That's the best way to do it. Each eye, each patient, even in the same patient, each eye needs different procedures depending on the stage of the glaucoma, the pressure, the number of medications they're using, the goal of the patient. There's some patients who are stable on 3 drops, so they just want to get off the drops. They don't want to keep using 3 drops the rest of their lives, and they want to have surgery or try surgery. So it really depends on all those factors. And again, at Chittick Eye Care, not only is it me looking at the patient, but we have the benefit of working with 11 great optometrists who also have all this history of the patient. So together, we decide what is the best surgery for the patient. iStent Infinite is really cool. It basically inserts 3 little stents into the trabecular meshwork, which is a fancy term for the drainage system of the eye. And it's the smallest implantable device in the human body. You actually need a microscope and a lens to even see it after I place it. But it works. It works on a lot of patients, and I can keep patients with low pressure without medications, especially if we catch the glaucoma early in the mild to moderate stages, which is the ideal time.
Which is, catch it early, and you can treat it early, which prevents some of these longer-term problems from happening. Let's talk about the drug delivery systems. There's been some new advancements.
Absolutely.
What's the latest? What's the greatest?
Yeah, no, it's really exciting. So for the last 5 years, I've been using a drug called Durista, which is basically an eye drop that we've been using for many years, but it's now in an implant that you can put inside the eye. It takes me 45 seconds to do it in the office.
So when sorry, let me make sure I understand. Sure. So you're putting an implant in the eye that continues to
slowly delivers the medication. And I've had patients where the implant has lasted up to 3 years, where they don't have to take eye drops.
How invasive is that? Is that like, do you feel it in there? Is it hard?
No, you don't feel it at all, because once it's inside the eye, you don't feel it. It's very small. Again, you need a microscope and a lens to see the implant.
Wow.
It's very tiny.
Super tiny.
It's incredibly tiny.
Wow.
Yeah. But again, for some patients, it's been life-changing, because I've had patients who've been on 3 drops for years, and I do that implant, and they're actually off medication for up to 3 years, which is fantastic.
That is incredible.
And then the latest thing is iDose. We're going to start doing iDose at Chittick Chittick Eye Care this summer. And basically, it's just that same medication, but it's now going to be in the eye stent and that implantable device I was mentioning before. And I can do it at the time of cataract surgery.
Wow.
So I can do cataract surgery, implant the eye dose, and again, up to 3 years, some patients can be off glaucoma medications, which is very liberating for patients.
It is. I was going to say that'd just be a load off, something you're not having to think about every day.
Absolutely.
Something that's been treated, and then you can retreat it again after 3 years.
Exactly.
That's incredible. Dr. Sola, thank you so much for being with us today.
Thank you for having me.
I love hearing about all the new stuff that's going on. We do appreciate Chittick Eye Care for sponsoring our segment today. To learn more about Dr. Sola and the services that he's bringing patients here in Central Illinois, head over to ciLiving.tv after today's show.